Congratulations, Carlos, to you and the other pioneers who are really bringing forward the first new treatment for depression in decades. So there's another new wave of treatment which involves drugs with dissociative effects, and this is the use by Roland Griffiths and also some researchers in England of psychedelic drugs, yes, actually, including psilocybin in the treatment of PTSD and also in the depression that can accompany end-of-life preparation. And they're reporting some pretty remarkable results with these drugs that may disrupt default network. So you're emphasizing that the ketamine's effect really may not be through the dissociation, but do you see any parallels to the effect of ketamine with the effects of these other drugs that
and so
that are
we
dissociative?
have, and that's an interesting question, and there's a very nice review in Nature Neuroscience about these psychedelic drugs and perhaps their role in psychiatric disorders. And so ketamine does produce at certain doses cognitive effects, which is interesting. Scopolamine has antidepressive effects, does produce cognitive effects. These other drugs do produce cognitive effects. Is there a common link? But that is, now remember some of these drugs were used in the past with psychotherapy, psychoanalysis, and they reported improvement, but of course, for restrictions, its use was stopped, and we didn't have many of the tools and technologies that we have today, so we can get a better sense. What are the circuits turn off with these drugs, how connectivity is increased or decreased, and what parts of the brain it is. And so now some people are doing these studies, and there haven't been many larger replicated studies yet, and it's a very difficult area of research for obvious reasons. I think it's a fascinating area. Now, some of these drugs are quite toxic, as you know, and some of these drugs, some of these patients may even have, re-experiencing of flashbacks of their experience, and so there are many unknowns of these drugs. But I do think, it does deserve a second look at, and to see what role they may or if not have. And they're also used in hospice care and pain management and so on and so forth. Thanks.
Thank you, Carlos.